Thank you, Tom. It gives me great pleasure to welcome Dr. Cindy Hutnik, this year's 10th Albert Waxer Lecturer. She's here tonight with her team. The team is made up of Dr. James Armstrong, Dr. Vinay Kansal, and in a few years' time to be Dr. Jacqueline Slomovic. Dr. Hutnik is a full professor of ophthalmology and pathology. She obtained her PhD and her MD at the University of Ottawa. She did her ophthalmology residency at the University of Western Ontario. She did her glaucoma training in Wisconsin in the USA. And I must say that Dr. Hutnik is the consummate academic. That means she's involved in patient care, teaching, administration, and research. In the area of patient care, she's internationally renowned as a glaucoma specialist. As a teacher, she's in high demand with medical students, residents, colleagues, and others. She's an amazing administrator. She is chair of the governing committee of the Academic Medical Organization of Southwest Ontario. She's been on numerous committees of the Canadian Ophthalmological Society, the Canadian Glaucoma Society, Eye Physicians and Surgeons of Ontario, and a number of expert panels giving advice regarding drug therapies. Dr. Hutnik is an internationally recognized glaucoma researcher. She's published over 110 articles in peer-reviewed journals. She's trained numerous students, more than 175 students, including PhD students, one of which is Dr. James Armstrong. Dr. Hutnik has a special interest in the development of new treatments for glaucoma or using existing medications to treat glaucoma, and that's very interesting. We therefore look forward to hearing her lecture tonight on the glaucoma neuroprotection study. Dr. Hutnik, thank you.
Well, thank you, Graham, and good evening, everybody. Graham, you've just made me blush, and that's not supposed to happen on webcam, but thank you for that very generous introduction. It is with utmost sincerity that I would like to thank you and your executive team for the invitation and the opportunity to be part of your annual general meeting. It's also without exaggeration that I would like to use this opportunity to express truly the impact that the Glaucoma Research Society of Canada has had not only on me as a clinician researcher, but on all of the students who have had the opportunity to participate in glaucoma research. So tonight we're going to use some of the next few moments to talk about the current study that was generously funded by the Research Society. But throughout that, we're going to talk about that underlying theme of impact, which I hope you'll all appreciate. So next slide. The best things in life are not done alone, they're done in teams. And I can't express enough how important this team of students have been in this project. Later on in the presentation, each of them will introduce themselves to you, and I'm hoping they'll share with you what it has meant to be involved with this project and the impact on their aspiring careers. So this is a little treat that I brought for you, and I'm sure you're going to enjoy that. Next slide. So our objectives over the next few minutes is actually, number one, to validate the ongoing importance of glaucoma research. It's been important in the past, it's important now, and hopefully we're going to understand how it continues to be very important moving forward. We all know that one of the most important things we can do in the management of glaucoma is to lower the pressure in the eye. But many of the doctors, and I'm sure all of Graham and Katie Bird and Raj will tell you, we have some patients where we get the pressure just as low as we can go, but yet they continue to progress. So we're always looking for something that can assist lowering intraocular pressure in managing our patients. The last thing that I would like to highlight is just the impact that the Glaucoma Research Society of Canada has had in creating new information for us as glaucoma doctors, but also helping our patients who suffer from glaucoma. So next slide. So the question is why? Why do we continue to think glaucoma research is so important? I had the opportunity to be a member of a provincial team which last year produced something known as the Glaucoma Quality Standards. And it was a consensus statement from the whole committee that not only is glaucoma the most common cause of irreversible blindness throughout the world, but we can't forget the enormous impact that it also has on our patients' qualities of life. So it's a disease that affects not only the eye, but it affects the whole person. So that's why we continue to need to do research. Next slide. So there was a study done, and it was a study that highlighted in Canada, there are a lot of Canadians suffering from glaucoma, more than 400,000 Canadians estimated to be involved. Next slide. If you look carefully at the author list, you'll see Dr. Catherine Burt, who is one of your directors, contributed very immensely to this publication, which has been cited throughout the world. It is Canadian data, and it's been cited throughout the world in terms of its importance. Next slide. The one thing about glaucoma that not only frightens me, but quite honestly, it sometimes offends me, because it truly is a disease which is the silent thief. The most common cause of glaucoma develops so painlessly and so gradually that the majority of people who have it don't even realize they have it until it's too late. So most of the nerve is sometimes damaged before the patient even has any indication that they have glaucoma. Next slide. So the other scary thing about glaucoma is today in Canada, walking around in cities like Toronto, cities like London, cities like Regina, Saskatchewan, more than half of Canadians don't realize they have glaucoma. So obviously there's a lot of work that still needs to be done. Next slide. So again, you'd probably ask yourself the question, how can it be that people have lost so much vision and don't even realize they have it? So the picture on the left shows you what a street corner would look like if you had your full vision. On the right, you'll see what that street corner will look like if you have moderately advanced glaucoma. You can see that your straight ahead vision is still preserved until the very end, but much of your peripheral vision has been lost. And the problem is when you get to this stage, next slide, you're very close to losing the vision completely. It's very hard to rescue the optic nerve and the vision when things get this far. So obviously we want treatments that we can start earlier. We want to detect the disease earlier, and we want to jump in as soon as we can. Next slide. So the thing about glaucoma, and you'll see my mantra, I think, on the next slide. It's a disease that affects the nerve which connects the eyeball to the brain. So it's a nerve disease. But one of the most important risk factors is high pressure inside of the eye. And in fact, as of today, when we're gathering here tonight, the only effective treatment we know to just reduce the risk that glaucoma will come and get worse is by lowering the pressure inside of the eye. Next slide. So what I often tell my patients is it's a little bit difficult sometimes to understand because glaucoma is not a pressure disease, it's a nerve disease. But the only way we know how to reduce the chance it'll develop or get worse is by lowering the pressure inside of your eye. And perhaps during the panel discussion, we'll hear from the other doctors on the panel that we all have patients where we get the pressure just as low as we can go, and yet the patients continue to get worse. So this is one of the observations that has prompted our study tonight. Next slide. So the question is, once we've gone as low as we can go with the techniques and the management, the surgeries, the lasers, the medication, are there any other things we can do to lower that risk? Next slide. So what we did is, myself and my team, we wrote a grant, and we were very fortunate that the Glaucoma Research Society of Canada decided to fund it. Next slide. Now, what we did in this grant is we said, well, are there any drugs, next slide, that are already approved, that patients are already using for some other reason, and they've shown to have the ability to protect nerve tissue? Because remember, glaucoma is a disease of a nerve that connects the eyeball to the brain. So the question we had, could these drugs possibly have any influence on glaucoma? Next slide. So what we did is we did what we call a big data database kind of study. So we decided to use the Ontario Healthcare Administrative Databases and specifically look for what are called off-target effects of certain drugs. And what we wanted to know, do these drugs either decrease the chance of developing glaucoma or the worsening of glaucoma? Next slide. So a key thing is we on purpose wanted to look at people in our community in the province. We thought if we find some data to support this, these will be very strong pilot data that may help us fund future larger studies where we look nationally and even internationally. I'll explain to you on the next slide what we mean by off-target, so don't worry about that term yet. And the last point to make is that this was a study involving humans. For many of you who know me, probably one of my greatest passions is fiddling in what we call the basic science lab with cells and molecules. But what we try to do is always translate that type of research to humans, because at the end of the day, we're trying to help our human patients who suffer from glaucoma. So if you look at this slide, on the left-hand side, you're going to see a number of medications. And if you look at the third column over, you'll see that these medications have been approved for use in Canada to either treat Alzheimer's disease or to treat high blood pressure, not eye pressure, but blood pressure, or to treat cholesterol. Next slide. So these are what we call the on-target effects, or the effects that allow these drugs to be approved to administer to patients. But for all of us who've ever taken a medication before, we know that many medications have side effects. Now, oftentimes, these are side effects we don't like. But what we wanted to ask here, is it possible that some of these drugs have side effects that may be beneficial? Next slide. So this is what we mean by off-target. Now, again, we want to sort of still kind of move around in the target issue because we want to address the idea of does this help the optic nerve? But it was not the reason why these drugs were brought to market. We just wanted to see if they had possible side effects that would be beneficial. Next slide. So the first hypothesis was that the use of these medications or drugs in patients without glaucoma would reduce the incidence of those patients developing glaucoma. The second hypothesis we had, in patients who have already been diagnosed with glaucoma and who also happen to be on these medications, does it reduce the chance that they will develop more or need more medications or more interventions because their glaucoma is getting worse? Next slide. Now, it's important for me to tell you that we're not here trying to prove anything. It's not a cause and effect. What we were merely looking for is what we call an association. Is there an association between using these other types of drugs and glaucoma? Next slide. What we hope for and gave some substance to this grant is that we were using what's called population level data. The so-called fancy term now we use big data. Let's see what happens in a lot of patients and see if there's some potential association. Next slide. So in the first part of the study, this is a little bit of the science here. We wanted to capture all of those patients on the Ontario database who we assume either do not have glaucoma or perhaps they're one of the 50% who don't know they have it yet. But at least we know that they're not on any glaucoma treatment. We then wanted to see which of those patients on medication developed a 5-year incidence of being put on medications or treatments for glaucoma. And what we did is we compared it to a group of age-matched normal patients who weren't taking any of these study drugs. So patients weren't on any glaucoma treatment. We wanted to see which were on our study drugs, which weren't, and then we wanted to look at the incidence of them needing glaucoma treatment. Next slide. So next slide. The next part of the study is we wanted to capture in those Ontario databases patients who had already presumed to have been diagnosed with glaucoma because they've received some sort of treatment. And we wanted to compare the group of those patients who were on one of those test medications to those who were not. And again, we wanted to look over 5 years, which of those patients needed a stepping up in their glaucoma treatment, whether it be more medication, a laser treatment, or a surgery, with surmising that if they needed more glaucoma treatment, it means their glaucoma was getting worse. Next slide. So the data sources, we included the Ontario Health Insurance Plan, and in HOIP, it captures more than 95% of services that are delivered by our doctors in Ontario. We also looked at the Registered Persons Database, which captures information from over 13 million people living in Ontario. We also captured and went into what is going on in the Ontario Drug Benefits Plan, recognizing that it primarily only will capture the data for patients who are over 65 years of age. Now, to put this all together and to give it some credibility and some substance, we made use of a very powerful entity, next slide, known as the Institute of Clinical and Evaluative Sciences. Not only do they have access to all of these databases, not only are they able to link these databases, they are a great analytical resource. Next slide. So in terms of what we're expecting, the study is well underway, and I'm sure the students might even fill you in at what stage we're at in the study. Next slide. The first thing that we are hoping for is to gather evidence that will support the potential protective effects of those drugs that we went searching for. The drugs not that have been indicated to treat glaucoma, but indicated to treat those other diseases. Next slide. Now, within each of those medication is an individual medication, but often within that group, we call it a class of medications. There may be other medications within that class that might be worth studying in our glaucoma population because of the potential strong theoretical rationale of how these drugs function. Next slide. And if indeed, because of this study, we find a strengthened association, it may actually justify the rationale to actually explore these drugs, specifically in glaucoma patients, in what are called prospective randomized clinical trials. Next slide. And again, we're not saying that these medications are likely to ever replace pressure lowering in the eye. I think that's still always going to be a very important strategy for treating glaucoma, but maybe, just maybe, they may be complementary and they may assist us in reducing the incidence of glaucoma or its progression. Next slide. So at this point, I'm going to stop talking. I'm going to turn the podium over to our team. And I think first on the list is Dr. Vinay Kansal.
Oh, thank you very much, Dr. Hutnik, for introducing me. So I'm Vinay. I'm one of the ophthalmology residents currently training at the University of Saskatchewan. I had my opportunity to meet with Dr. Hutnik now. It's been about 4 or 5 years back when I was a medical student and I had done an elective at Western University and had the opportunity to work with her. And since then, we formed a very fruitful research-oriented relationship, and I've been involved with many projects with her. This was the first project with her where we were actually able to obtain funding from the Glaucoma Research Society of Canada, and for that we are incredibly grateful, because without your support, frankly, this project would not be able to get off the ground. The ICES organization is a fantastic organization, but in order to get the support of their analysts and epidemiologists, funding is definitely required. And I think, as Dr. Hutnik had mentioned already and discussed in detail, our current management of glaucoma is truly just focused on lowering the pressure in the eye, which unfortunately for some individuals is not sufficient to be able to halt the progression of their disease. And so in our investigation, we are really trying to find potential associations with other existing medications that may actually help treat or slow down the progression of glaucoma through other mechanisms. Next slide. And so for me, I think it's a very interesting topic, and I'm just very, very pleased to be able to be involved. And also on a personal level, for me, this has been a very humbling and wonderful experience. Currently I am hoping to pursue further fellowship training in glaucoma surgery, working with the physicians here, working with Dr. Hutnik and others. I've really developed a keen interest in glaucoma and recognize that in our community and worldwide, it's a condition that really we don't have a full grasp on exactly what is causing glaucoma and how to quote unquote cure glaucoma. Really, most of our treatments right now are kind of aimed at slowing the progression and trying to improve quality of life. And I'm really hoping that over the course of my lifetime, we can perhaps come up with a cure. And so the support from yourselves at the Glaucoma Research Society of Canada has really enabled me to pursue both meaningful research projects and also engage with a community of glaucoma researchers and clinicians to further my personal goals. And for that, I am truly grateful. So thank you very much, Dr. Hutnik, Dr. Trope, and the whole organization and all the donors.
Sorry, Jacqueline, you're going to have to unmute. Unmute and just go one more time.
Thank you. First of all, I'd like to say thank you so much for having me this evening. It's an honor and a privilege to be able to say a few words about our study. My name is Jacqueline Slimovic, and I'm a second-year medical student at McMaster University. I am also part of the research team under the leadership of Dr. Hutnik, who has kindly asked me to speak briefly about our neuroprotective study tonight and why I feel it's so important and how this opportunity will impact my future career aspirations. Please advance to the next slide. Thank you. Being involved in the study and in Dr. Hutnik's lab has had a tremendous impact on my future career aspirations. Firstly, through being involved in this project, I've been exposed to excellence in leadership and mentorship. Dr. Hutnik has assembled a wonderful team and inspires each member to strive for their personal best. Within her lab, Dr. Hutnik also facilitates collaboration, which has allowed me to learn from my fellow lab members, develop new skills, and to become a better researcher. Dr. Hutnik has taught me the importance of asking good questions, which brings me to the next reason why this study is so important to me. This study is exceptionally innovative as it uses neuroprotective medications that have already been proven safe and effective in the treatment of other conditions in order to treat glaucoma. This typifies the adage that great research builds on current knowledge bases in order to further contribute to scientific advancement. Finally, this project inspires me as it aims to treat glaucoma, colloquially known as the silent thief. One of the fundamental reasons that I've pursued a career in medicine is to enhance patient care. Thus, it's my hope that through this study, Dr. Hutnik's lab will be able to find a way to prevent glaucomatous damage and to preserve quality of life for patients. My colleague, Jake Armstrong, will now continue this presentation.
Hello, and thanks, Jacqueline. My name's Jake, and I'm an MD PhD student, meaning that I completed my PhD during my medical school education. Currently, I'm actually in the last year of my medical school education, and next year I hope to match an ophthalmology residency, like my friend Vinay you just heard from. Ideally, with this type of training, my future workday will be split between caring for patients and scientific endeavors focused on bringing new treatment strategies and improved therapies to patients. I love what I do for many reasons, but in particular, these two endeavors are extremely synergistic and will allow me to bring the best to my patients from the world of research and bring my first-hand experience attending to the needs of patients into the world of health science research. My job is to straddle the fence between these two worlds and bring perspective to each side of the industry. I was extremely lucky to be able to do my MD PhD under the extraordinary mentorship of Dr. Hutnik. With her direction, and especially with the support of the Glaucoma Research Society, I was able to augment my medical school education with scientific training that allows me to confidently draw on the solutions provided by the three main pillars of health science research: human medical research, animal models of disease, and cell culture to better find solutions for the problems that tomorrow's patients will face. More than that, however, I was extremely lucky. It has given us the opportunity to pass on, in turn, these great experiences and skill sets to many younger learners, and for us to build a community of young ophthalmologists and vision scientists who are passionate about improving the vision of Canadian patients, and have the skill set required to address both the current and future needs of glaucoma patients. We're all extremely grateful for your support, and it would not have been possible without the generosity of each of you. Thank you.